All right, today we have Jen Sears, our Chief Information Officer and Privacy and Security Officer at the Coordinating Center, joining us to talk about health information. So we'll go ahead and get started. Jen, thank you for joining us. Again, you can add questions to the chat and we will answer them after the presentation.
Heidi. Welcome, everyone. Today we're going to talk about how you can help protect your health information. So as Heidi said, I am Jen Sears. I am the Chief Information Officer and Privacy and Security Officer at the Coordinating Center. I have been here almost 13 years and have over 25 years of experience in marketing and communications, technology, and privacy and security. So just some ground rules for today. As Heidi mentioned, this part of the presentation is being recorded. The end where we'll be doing Q&A will not be recorded. During the presentation, we ask that you remain on mute and have your cell phone silenced. If you have some questions throughout the presentation, feel free to enter them into the chat and we'll get to them when it's the Q&A portion of it. Just a reminder that this is a safe space, so there's no judgment, and we ask that any information shared within today's presentation remains here. And the slides and any unanswered questions will be emailed to all participants after today. And just a disclaimer that this is for informational purposes only and not a substitute for professional advice. So today we're going to talk about how to protect your personal health information, which I'm going to be referring to as PHI, how you can communicate securely with your providers. We're going to talk a little bit about Maryland's Health Information Exchange and how that works. We're going to learn how to identify and avoid scams, and then what you can do if your PHI has been exposed. So recently, 79% of US adults reported being concerned about how their data is being used. And if you look at this next number, it's rightfully so, because in 2024, 3,100 data compromises affected more than 1.35 billion individuals in the US. So information being obtained by other people, used by other people, is very prevalent. So it is important for you to know what you can do to protect your health information. So what is personal health information? So your PHI is any identifiable health information that is used by providers or their business associates that can identify a specific person, whether it be your name, your birth date, your social security number. And there's some things that you might not even think of that is considered PHI. So it might be the name of your emergency contact. That's one of them. It may be even a photograph can be considered PHI. If you are getting a, let's say, a ramp on the front of your home and the provider needed pictures of your homes prior to installing the ramp, that could be considered PHI. So everything we're talking about today is anything that can identify you as a person and or a part of a program. So if for some reason your PHI is not protected or it becomes exposed or compromised, some things can happen. So identity theft might occur. Individuals have enough information about you, that they sometimes can open accounts using your identity. Then there's also the for also insurance fraud might occur, or since they have unauthorized medical record access to your information, they can do other such things with that information. So here are some best practices of how to keep your personal information safe. So one, use strong and unique passwords. So when we say strong passwords, we're talking about passwords that are at least 8 characters in length. You are using upper and lowercase letters, you're using numbers, and then you're at least using one symbol. And unique, we mean that you're not using the same password for multiple accounts. It's important to use one password for each account that you have. It's a good practice to change your passwords often. So luckily today, a lot of apps and websites that we log into require you to update your password every 60 to 90 days. But if that's not the case, and especially accounts that you're using related to your health and medical information, it's a good idea to go ahead and change those passwords on a regular basis. If the app or the website offers two-factor authentication, take advantage of that. This is very popular, especially with banking accounts and medical accounts. Avoid using unsecure Wi-Fi. So make sure when you're logging on to these apps or websites that you're using a secure Wi-Fi. So if you're at Starbucks, you're getting some coffee and you want to log into your accounts, don't do that because those are often unsecure Wi-Fi. It's important to keep your devices and operating systems up to date. So a perfect example of this is in October of last year, Windows 10 stopped being supported by Microsoft. So everyone was encouraged to upgrade to Windows 11. So hackers or individuals who are looking to steal information could see what devices were still on Windows 10. And that kind of gives them a hint that you might not be protecting your information as you should. So it might make you vulnerable for accessing your information. Make sure that you're downloading apps from trusted sources. So if you use the Google Store or the App Store, always make sure they're coming from places where apps are downloadable. Review the privacy settings on apps. So sometimes when you install an app, a screen will pop up and there might be some options that say, can we use your camera? Can we have access to your location? If you can opt out of those or turn those settings off, that's preferable. If for some reason the app does not let you change those privacy settings, then I recommend that clicking on the pop-up that says only use these things when the app is in use. So meaning when you're not using the app, it's not tracking all that information as well. It's important to monitor your accounts regularly. So, anything that has health information in it, if it's a physician's portal that you're using, your bank accounts, make sure you're monitoring them on a regular basis. And then if you are getting a lot of emails from listservs and unwanted texts, always choose to opt out of those because those are just other ways that people can get your information or tempt you to enter information into unreliable sources. So how are some ways that you can securely communicate with providers? So A lot of hospitals, large healthcare systems, even private providers have patient portals now. So that's a good way to communicate with your provider. Also, encrypted emails. So at the coordinating center, we use encrypted emails. So if we're sending clients any PHI with it in, we will always send those emails encrypted so that your information is secure when it's being emailed to you. Texting PHI is very unsafe. So it's never a good idea to include PHI in a text message. So at the coordinating center, we will never send you a text message that has PHI in it. If you initiate the conversation with us via text and you have PHI in it, we're going to remind you that that's an unsafe way to communicate. And we're going to suggest either calling you on the phone or sending you an email to discuss your information further. And then obviously social media, you don't want to publish any PHI on social media. And then even web forms, a lot of times when you enter information into web forms, that information is being secured somewhere, most times by a third party, and you don't automatically know that that information is being stored securely. If someone calls you on the phone and starts asking you for information, your social security number, anything about passwords, you should always confirm who is calling you and the reason for why they are asking you this information. So this happened recently to my husband where he got a text and it appeared that it was coming from one of the banks that we use. And the text said that there had been an unusual charge and they wanted to discuss it with him. So, red flags didn't go off immediately because him and I have both got those texts in the past and they were legit. And once he got on the phone with this person that texted him, he could tell that it was not really the bank facility that we use because they were asking questions about, passwords, our PIN number. And so what he did at that point was immediately hung up, went to the internet and looked at what is the customer service number for that bank facility and used that number. So that's always important. If you are unsure of, someone has called you, someone has emailed you, do not use the contact information that they provide for you. Go and look up that information someplace else to make sure that you're actually getting to the person or the facility that you want to talk to. And again, like I said, like when a health provider is calling you, they normally aren't asking you about your social security number, anything about passwords related to the portal. If that's happening, that should kind of set off some red flags that it might not be legit either. All right, so what are some tools that you can use to store or track your health information? So patient portals, as I said, many of us probably have one or more patient portals that we're using now. MyChart is very popular. There's several different large medical facilities in the state of Maryland who use MyChart. Healthy Life is another one that's popular. And the patient portal allows you secure access to all your medical records. Sometimes you can schedule appointments through your patient portal. You can request a refill for prescriptions and even might be able to communicate via email through the portal to your provider if you have a question. There's many different healthcare apps out there, ones that can track your medication, other ones that help monitor your vital signs or, your glucose. There are ones that help you achieve your wellness goals. There's exercise, nutrition ones. They're endless. But just remember, make sure that you're downloading these apps from a reputable source. And then I mentioned in our opening, I'm going to talk about the Health Information Exchange. So this is a portal that is used to store information about individuals in the state of Maryland, and their health information and their providers. So that health information exchange is called CRISP, which stands for the Chesapeake Regional Information System for Our Patients. So CRISP securely connects to all Maryland hospitals and any other healthcare or community providers that want to be part of CRISP. So the coordinating center, we do obtain information from CRISP on our clients. And the organizations, once they sign up with CRISP, they decide what patient information they will share with other providers, and then also what information they want to receive. So at the coordinating center, we receive alerts about our clients when they're either seen in the emergency room or admitted to any hospital within the state of Maryland. And then CRISP does not have access to all your health information because you might be going to a provider that has not chosen to share their information with CRISP. But so how it works is if you have some doctors who are associated with Johns Hopkins, and then you have other doctors that are associated with the University of Maryland. Both those systems feed into CRISP. So if you go to a Johns Hopkins doctor, they can see what medications have been prescribed to you from the physicians at the University of Maryland. So it's basically a one-stop shop for providers and community health organizations having the ability to see your information all in one place. And then CRISP is required to follow all state and federal privacy laws. Just as any provider that uses CRISP, they must follow the state and federal laws. And then CRISP agrees to keep your data safe and not share it with anyone that you do not allow to see it. So CRISP used to be an opt-in HIE, but it is now an opt-out. So if you do not want your information as part of CRISP, you must do one of these three things to opt out. There's an online application that you can fill out and submit. You can call this number and someone at CRISP will make sure that you're opted out. Or there's a form on their website that you can print out and send via the mail, letting them know you want to opt out. All right, so some ways to avoid scams. As I said, they're very popular and they're getting more and more sophisticated as time goes on. So we want to make sure that you know what are some red flags to avoid scams. So scams can come in many different forms. So it can come as a phone call. It can come as an email. It could be a letter in the mail, or it could be via text. So some of these apply for all of those that I just mentioned. Some only apply for a few, but these are all good things to look for. So anything that is an urgent request, that should set off red flags that maybe this is not a legit request. If they are asking you for money or payments up front that don't seem normal to you, that should be another red flag. If you are being unsolicited, you might have never even heard of the supposed person or company that has reached out to you. If their request it has a lack of transparency, so it's very vague, you don't understand what the information they're asking for is, how is it going to be used, that's another red flag. For emails, if you have a link in an email, without clicking on the link, you can just scroll over that link and a little bubble will pop up and it'll show you what the link is. So it will have the exact address. And a lot of times when these scams are being sent out, the link doesn't match with either the company or supposed person that is sending you this. So you should never click on a link in an email if you have some, something has gone off that you're like, oh, I think this could be potentially a scam. Same with attachments. That's another popular way they get you. Do not open any attachments that you don't know where they're coming from. The email might include poor spelling or grammar. Another popular one is there might be different font sizes. So the salutation might be in 20 font, and then the body of the email might be in 12 font. Generic salutations, it might just say sir or ma'am. Does it use your name? Wrong logos. So again, this is one thing where individuals who are scamming have gotten very sophisticated with, and the logos are so very close to the real thing. You really need to look at the logos. It might just be a small adjustment. Sometimes it's just one letter that is left out in the logo. And because you know that logo, you know that name, you just kind of glaze over it fast because you see that logo all the time. But to really look at logos when they're presented in emails. And if they're saying that something is free or the offer is too good to be true, it likely is too good to be true. So don't let that entice you to do what they're asking you to do. So like I said, one way to avoid the scams is don't click on links or attachments. Don't give out PHI over the phone unless you have verified and you are sure the person you are talking to is that person and they're from the facility or organization that they say they are from. If you're suspicious of anything, verify if it is legitimate or not. So again, going to the internet, looking up the phone number, customer service number, and use that number to contact them to see if it is indeed a real email or letter or phone call. And then don't share your passwords. Keep your passwords protected. All right, so what can you do if your information has been compromised? So there's one of two ways that you might find out that your PHI was exposed. Either you were notified or somehow you discovered it on your own. So if you are notified, you will receive it sometimes can be an email, most likely it's a letter in the mail, and it will tell you what information of yours has been compromised, if they know the exact date that it was compromised on, and then what was the time frame for that. So, for example, you might get a letter that says, you know, XY facility discovered on April 5th, 2025, that your name, social security number, and email address were compromised between January 1st, 2024 and September 30th, 2024. So read the communications very carefully because that will give you the information you're looking for of what you should be on the lookout that was potentially compromised. You'll want to monitor all your accounts. So again, that includes your banking accounts, any health related portals, apps, if you are going on to sites for Medicaid and Medicare, make sure you're monitoring all of your accounts. So you can, if they do use your information for something, that it's caught quickly. And then in a lot of cases, especially if the compromise was widespread, the facility organization will offer free credit monitoring, usually for a year or two. Take advantage of that. That's no cost to you, nothing extra that you really have to do, just sign up for it. And that kind of gives you a peace of mind that someone else is also monitoring your information. If you discover on your own that some of your PHI was compromised or exposed, I recommend contacting the facility or the provider first. If it's a large facility, you want to ask to either talk to their privacy officer. Some organizations have a compliance department. That's another one you could ask for. Oftentimes in hospitals, this would fall under the risk department. So contact them, let them know what you've discovered, and see what they're going to do to resolve the problem. And then if you do not get the result that you want from them, and or if you just you do but you still want to, you absolutely can report it to the Office for Civil Rights. So this link here will take you to the page where you can fill out a form to report the compromise, and then it'll also show you a list of companies and organizations that have had exposures within the last year and can provide you more information about those exposures. All right, so now time for questions.